I'd like to call Health Committee meeting to order, the August meeting. Let's go to the Lord in prayer. Father, thank you for today. Thank you for travel graces you gave to each and every one of us to get here. We pray that we use our collective wills and collective intellect to make decisions that are pleasing to you, and we thank you for the way you provide for us as individuals and as a tribe. In Jesus' name, amen. Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski. Here. Sasha Black Fox Qualls. Here. Danny Callison.
Here.
Julia Coates. Joe Deere.
Aye.
Kevin Easley.
Here.
Lisa Hall.
Here.
Johnny Kidwell. Daryl Legg.
Here.
Kendra McGady. Here. Cody Poindexter.
Honey.
Joshua Sam. Mike Shambaugh. Melvina Shotpouch. E.O. Smith.
Here.
Condessa Teehee. We have a quorum.
Thank you, Shelley. If you had a chance to look at the minutes, I would entertain a motion to approve. All those in favor? Any opposed? Motion passes. On to reports. We have another different individual. Dr. Nix is going to be here to represent the Claremore Service Unit. Thank you, Dr. Nix.
Here. Dr. Micah Nix. I'm currently the acting clinical director at Claremore Indian Hospital. I've been in that role since the beginning of the year. We're just kind of getting ready for the transition, obviously. Before that role, I was the chief of emergency medicine of the emergency department at Claremore Indian for around 10 and a half years before that, and came to Claremore as an IHS payback scholarship. And so just appreciate you guys having me here today. I believe I'm filling in for Tony Deckard here, so he told me to have you hold all the hard questions for him, and he'll answer those later on. But I do believe there's a report that you guys have from our hospital in your packet there. Other than that report, there's nothing else to report. We're just kind of getting ready for the transition phase, looking at timelines for services, and getting ready with the staff and all of those preparations we're doing. So that's really the length of my report. If you guys have any questions, I'll certainly take them.
Questions for Dr. Nix? Go ahead, Sasha.
Thank you, Chair. Thank you, Dr. Nix, for being here with us and for the report. With the transition and with the upcoming OB changes, do we still provide censoring there at Claremore?
Centering is a service that's been going on for several years there. They're actually winding that service down, and it will end on September 30th.
I'm sorry, what was that last part?
It'll end on September 30th, is my understanding.
Okay, will we be offering prenatal education classes?
Prenatal education, we'll be providing prenatal care there, is my understanding, but prenatal education would fall outside of my scope of what's going on right now.
Okay. Maybe I'll follow up with Dr. Jones. Thank you.
Others? Got off easy, Dr. Nix.
I'll take it.
Thank you for your report.
Thank you all.
From our Cherokee Nation Health Services, Dr. Stephen Jones.
All right, good afternoon. To answer your question, we are going to provide support. I don't know exactly all the details of the support. We're still working out all that, but prenatal support is something that's important, and we are going to provide that. So, all right. The report's in your packet. I don't know if there's any questions on it. I'll be glad to answer it. I want to give a little bit of an update on Claremore. I know that that's part of the things people are asking questions about. We finished our first round of job offerings to the employees there. That was limited and exclusive for those employees. We had 189 acceptance so far. We have 18 out of 18 on MOAs, which is our commissioned officers that took the positions that were offered to them. On providers, we met with providers the week before last, Dr. Harp and myself, and we had 29 providers that we offered contracts to. Currently, 20 of those have accepted their positions. 6 are pending, and 3 have decided to go elsewhere. So that's a really good percentage of retention on the current staff. There's been some questions about, and and I think some things being put out there that we're decreasing the provider staff, and that's simply not true. Just in primary care alone, currently you have one primary care provider that's on staff. Everything else there is locums. And so we're increasing that to 4 primary care providers right off the bat that will be located there that are actually employees there, not locum tenens, they're just coming and going. They have 3 APRNs right now. We're increasing that to 5. And then pediatrics, they have 4. 3 of those are staying with us, and we're increasing, I believe 3 is I was told, and we will keep 4 there. So we're not decreasing the number of providers in that clinic. That's just simply not true. So I just wanted to set the record straight on that. The second round of applications or job offerings will start tomorrow, and that's going to be open to everyone that's a current contractor there and the outside of that facility. So the first round was exclusively to employees that were full-time there. In the second round, if you're a locum or you're a contractor that's been brought in by their contracting group, Chenega, I believe is the name of it, those people will have an opportunity to get full employment if they want to apply. So we're entering that phase tomorrow. So any questions on that before I go on and talk about something else?
Go ahead, Dr. Jones.
Okay. Okay. The EHR, we had a little bit of a downtime last week. As you know, we kind of talked about that in our individual meetings. That everything is back up and running. The only piece that we haven't turned on yet is the patient portal. They anticipate they will get that back up and running today. It may be up now. They were trying to get it up before I came into this meeting, but I told them we don't need to cut any corners. We need to take every opportunity to validate and verify before we turn that switch on. And the reason it's the last thing to come on is because it touches so many pieces of our health record. So those pathways have to be absolutely accurate because it's information that leaves our health system, comes to the patient. So once it leaves and goes into the patient portal, we don't have control of it anymore, and we want to make sure it's absolutely accurate before we turn that switch on. We anticipate it'll be on by this afternoon, so that's the last piece to get everything back up and running the way it was before. Any questions on that? Sorry, I'm a little short of breath today, so I'm a little, my voice kind of gets a little weak. Try not to
See
cough.
none, go ahead.
Everything good?
Good,
Okay.
yeah.
In the report, everything is pretty, I don't think there's anything that's out of line. I went through it and tried to anticipate anything that I thought looked a little out of the norm, but everything is normal for this time of year. Of course, this is the June report, so we're a little bit behind from where we are currently. And usually in June and July, we see the trends come down a little bit as providers take vacation. Numbers come down just a little bit. A lot of people are on vacation, so you don't see as much activity going on in the clinics in June and July. Now, in August, that always kicks back up because school's getting ready to start. So we have all the rush to get ready to go back to school. So with that, I'll open it up for questions.
Any questions for Dr. Jones? Sasha?
Sorry, I just wanted, I misspoke. It's not the prenatal education, it's the childbirth education classes that I was inquiring about. Also, the Head Start Roundup days, do you know if those have been rescheduled and if you have dates for those?
I don't have the dates in front of me, but yes, I do know that they've been rescheduling. Some of those, they're working with obviously to get all the kids coordinated again. But to my knowledge, everything that was displaced has been put back on the books now. Even our surgeries, our elective surgeries that were displaced, met with Dr. Ward on Saturday, and he told me they had a plan for every single person that had a delay to be put back in the next 2 weeks and have their procedures taken care of. So the staff has worked unbelievable. We have emergency protocols. When something like this happens, we go to paper. So a lot of things are done on paper, and a lot of things will be for the next week or two. Those things will all be entered back into the computer, into the health system. So we have a lot of emergency things that we already have set in case we have power outages or we have Wi-Fi go down, or in this case, the computer system go down, that allow us to continue to see patients and continue to do what we need to do. And I would say that, probably 60 to 70% of the patients got served throughout this process. There was a few patients that were displaced. But if you think about it in relation to an inclement weather day, last year we had 3 inclement weather days right in a row when we had 18 inches of snow. And during that time, we're completely shut down. So if you compare a comparative, we had 4 days where our tool was not available to us, but our staff made adjustments. They sought to overcome and had a great attitude about it. And they found ways and brought to us, say, what if I do this? Is that okay? What if I do this? And that's the kind of workforce you want. Everybody's pulling the same direction to make sure the patients are taken care of. And I could not be prouder of the way everybody handled themselves over that week. Our IT staff, I have to give a shout out to them. I would bet they put in 100+ hours last week getting everything going. They were working day and night. As a matter of fact, on Friday night, we finally said, go home. Go home tonight. Let's reconvene tomorrow at noon. Everybody get a good night's sleep, and let's start validating. So I can't express enough how much our IT team worked and the job they did to get everything back up and running. So things like this happen. They're unforeseen, of course, but that's why we have emergency protocols. We're going to be using this as an example of something that could happen in the future if we ever had a cyber attack or something of that kind of thing to happen in our health system. How are we going to react? This time it was all a sterile environment. We didn't have a cyber attack. It was all contained, and so we're able to take our lessons learned and how we made adjustments and apply it for business continuity. So a lot of lessons learned this time, and we'll be better for it next time.
Thank you, Dr. Jones. And
Yeah.
I'd just like to speak with you before you leave.
Sure.
All right, thank you.
Absolutely.
Thank you, Chair.
Daryl?
I don't have a question, just if you can hang out after this meeting.
Sure. Absolutely.
Anything else for, Danny, yeah.
Dr. Jones, with school getting ready to crank up again and being involved for many years in athletics, do we offer any kind of a physical program? I know if they all go in, and, during the day, they take up appointment slots. Have we ever thought maybe of doing something where each town that we might be able to do the physicals where they don't have to go somewhere else? Or
We do, and we usually take our mobile unit and go out, and our residents our family practice residents go, and we do physical examinations. Now, schools have been set up to do that, and some schools want us to come and do that, and some schools don't. So the schools that we work with, we definitely do that, and we'll do a whole evening, and we'll do sports physicals for the whole school.
So we actually reach out to these people?
We actually go to them, yeah.
Thank
Yeah,
you.
and Counselor Sams can probably talk about it. We go to Stillwell, we go to some of the other schools that have those agreements in place to allow us to do it. We've offered for a lot of schools. Some schools don't want that cooperation or don't want it, but the ones that do, we try to accommodate all the ones that do.
Thank you.
Junior?
How far in advance would they have to give you notice, like they already have it this year, but they're worried about next year
For
for
the
those physicals?
sports physicals, it's usually ran through like I said, through our residency program. Dr. Nolan was the one that headed that up for years, and he's passed it off to Dr. Beck. So he runs that now because he oversees all of our residency programs, and they coordinate through that department. Yeah.
Dr. Jones, huh? Okay. Mike?
Yeah, Doc, have you had a chance? I know you have a ton on your plate, especially with what happened to our computers. But have you had a chance to look at the dialysis situation again, and the telemedicine? I mean, Secretary Kidwell had a question about that too. We haven't heard anything in a while, and is that still something that we are looking at implementing throughout our reservation? Because it really is a hardship on people to travel to get dialysis. I get a lot of calls on it, and it's very difficult. And a lot of them have to carpool, and sometimes if the person who drives can't go, then that person goes without, and it's very difficult. In my area, I know it is in some other areas too. Have you heard anything about that?
So the report was extended to be ready for the chief's office by August 30th. And the groups have been working together. They've also been coordinating meetings with myself, Chief of Staff, and Deputy Secretary of State to finalize the report, and I don't see any delay in having that report to the Chief's office by August 30th. As a matter of fact, it should be ready in the next week, and we'll be ready to turn it over, and then once the Chief reviews it, I'm sure he'll make it public record.
Thanks, sir.
Yep.
Thank you, Chair.
Dr. Jones, just in way of comparison, right now, do you know how many dental chairs there are at Claremore?
14, I believe. 14 chairs at Claremore.
When we get done with ours, the new one, is that going to be in that ballpark, or is it?
I think we're anticipating 16 chairs. It works out better on a model of 4, 4, and 4.
Yeah.
And so we're going to be increasing it, I believe, to 16. I don't know that that's absolute yet.
Yeah.
They're still looking at the footprint and how much space we have and how those spaces coordinate. As a matter of fact, today, those teams are meeting at CNOC and going over all the things, what the dream, we're at that point where if you could have anything, what would it be? And we're taking that information and coordinating it together and trying to meet with the department heads, the people who are actually working in those departments, and finding out what it is that they would like to see. So we can start coordinating that and putting it into an actual footprint. So that design process is already working as we speak.
Okay, thank you. Okay, thank you for your report, Dr. Jones.
All right, you're welcome. Thank you.
Up next, our Public Health Department with Ms. Lisa Pivek.
Good afternoon. It's good to see all of you. You have our report, and I'm up for any questions that you have. This last week's been a super busy week. As many of you saw, the opening of the Stillwell Wellness Facility, the Mary L. Holland Carson facility. That first week has been pretty successful. I think on Tuesday or Wednesday, they clocked 300 folks coming through the doors, up to about 1,500 members right now, and keeping that going. Really, really proud of the staff. If you haven't had a chance to look at it, the attention to detail and the training of the staff prior to going in there, they're really, really caring, really making it a place that everybody wants to go and get healthy. And thanks to our partners with health services, too, as we see some of those staff coming over as well. Really excited. The Kawi Cafe that's in there, for many of you that know about that, that is scheduled to open this coming week. So have that. We also have Salina's Wellness Facility grand opening next Tuesday, so we're working on that this week as we move through the week, and have all kinds of same projects going on, WIC, setting up for fall vaccinations, all of the other activities that we normally have going. So I'm happy to field any questions that you might have.
Candace?
Well, thank you for joining us this afternoon. I was it was almost overwhelming to be at the Stillwell opening because it is just such a beautiful facility and is going to mean so much to that community. While I was there, I started thinking about the Tahlequah Wellness Facility, and I wanted to ask about the kind of forecast for that and what we might be looking at for the opening there.
From what I've been told, we're looking at sometime late next year, closer to the end of 2026. You know, that's always fluid, as you know, construction projects are, but that is what I have been told. Working on those programs as well and trying to get, that's going to be a little bit bigger, obviously, than the facility now. That's a Marcoma facility, so getting all that staffed and ready to go and hoping to have the same kind of programs, additional programs at the Tahlequah facility.
Right. And the Marcoma facility, as it stands right now, the staff is doing a lot with the little over there. And you know, the Marcoma building, it is, gosh, I'm trying to find a nice word, but it is definitely time for a new building in Tahlequah. I would like to speak with you maybe a little bit at another time about if there are any plans for that Marcoma building. I've had some questions from seniors in the community who just really love that building. So I'd like to speak with you about that maybe at another date. Maybe we can have lunch or something.
Yeah, sure. That'd be great.
Okay. Thank you for the time, Chair.
Josh?
Thank you, Chair. Yes, definitely, that was a great opening, and I don't know if I could say unfortunately, fortunately, I've been there every day since it's open. I've been sore every day, but also I just want to let you know that you and your team's done an awesome job. The staff there, they've been so welcoming, and as I've been going each day, you see the cars just piling in there. Even at this morning, there was a double the amount I seen from last week. So the facility, the team you have there running it, they're just doing an awesome job, and I just want to let you know that.
Thank you. I'll pass that on, yes. Really, if you haven't had a chance to look at it, it's more than a gym. It's not a Gold's Gym. It's more like a YMCA or a community center. We've tried to make the feel of it when you come in, to have classes and have everybody welcome there and try to provide people with other services and link them to other services across the Cherokee Nation. So I have to give all of that to the staff there. Have really worked hard, their hearts and souls. Most of them live there. Really, really proud of all of them. And of course, as I said at the opening, and I said again, this wouldn't be possible without the great work of health services.
Just a comment, if you look throughout the reservation at all the places like this is the way it is. I mean, our people have been needing this for a long time, and they are showing up. Kenwood, they're showing up. I mean, hundreds of people that who would have thought? And that's exciting that we're doing things like that to help. Probably the best thing we can do to help our citizens out is give them a place to work out, especially because diabetes is so bad. And if you don't have those places, if you don't have opportunity, it's not going to happen usually. So, man, kudos to you. So.
Yeah, I did mention, some of the staff told me this morning that last week they even networked with the Wilma P. Clinical staff to talk about how they could get back and forth refer, get people over there, and do more of a partnership. So, yeah, we're saying Kenwood is impressive, and I think a lot of that has to do with those community orgs as well, working together in the community buildings and making it successful. So, thank you. Any others?
Lisa?
I wanted to also mention what Speaker was talking about. There was 3 ladies from the Tahlequah Marcoma Gym, the elders. They're from the volleyball team.
Yes.
So they were hoping to find a group from Stillwell, and they're starting to go to each wellness group, and they're going to start playing each other. So,
Yes.
they're getting these elders out, and they're getting competitive. So, it's always good to see our elders out because it gives them a place to go socialize. And,
Yes.
and I want to be just like them.
I think that's one of the strongest programs at
Yes.
Marcoma is the senior fitness and
Yes.
their chair volleyball league and
Yes.
team. Very competitive, ready
Right.
to go. Yes, so we'll have to get still up and going in the other places as well.
Yeah, so Josh, we're going to be challenging you.
Kevin?
I just have a quick question, if you don't mind hanging around.
Sure,
Thank you.
absolutely.
Anybody else?
Thank you.
Thank you, Lisa. Old business, none pending, new business. There's item number 1. Johnny, would you mind reading that for us, please?
Sure will, Mr. Chair, thank you. This is a resolution in support of a partnership with Hillcrest for the provision of obstetric services at its Claremore facility, and I move for its approval.
Second.
We have a motion and a second. Any discussion? Huh? As soon as we approve it, I guess. All those in favor? Aye. Any opposed? Motion carries, and it will be, Shelley will make sure this goes to full council. All right, thank you, Shelley. Okay, any other announcements? Any other health-related announcements? Okay.
Just want to say thank you for the job you've done sharing health. You've done a great job, and it's been an honor. I know we all feel this way. It's been an honor working with you, Doc. Really has.
I appreciate that, Speaker. It's been a privilege. And Lisa, sharing all the new community buildings that are available now for our citizens, and if we just, it's really pretty staggering what we've done as an entity, the healthcare facilities that have gone up. We just came from from Fort Smith, joining Mercy Hospital in a cancer facility. I mean, if you just pause and think, it's just really staggering where we've come from in the last 5 years. We've had some really forward-thinking leaders and leaders that are not afraid to put action behind the words, and that's and we're just staying up to date as best we can. I think we, as Chief says, we have close to a world-class healthcare system. But anyway, I appreciate those kind words, Speaker. Okay, need one more motion. All those in favor? Aye. Any opposed? Motion passes